You woke up this morning, went to the bathroom, looked in the mirror, and maybe you noticed something strange about your tongue. Maybe it looked whiter than usual, maybe a bit swollen, maybe you saw marks on the sides where your teeth press against it. You probably thought it was nothing, brushed your teeth and went on with your day like you've done for years without thinking twice. But researchers at one of the world's leading medical universities discovered that this seemingly harmless sign could be your body's way of screaming. It could be screaming that something serious is happening inside, something involving your liver and your intestines, two organs you can't see. And the most surprising part is that the solution isn't complicated. It's actually so simple that you'll wonder why nobody told you sooner. For decades, most people believed that a white coating on the tongue was just a hygiene problem, something a good brushing would fix. Doctors would tell patients to scrape their tongues more often, to use mouthwash, to drink more water and call it a day without asking why. The truth is that your tongue is like a window into your digestive system, and when it shows these signs, it's revealing something deeper. That white layer and swelling aren't just sitting on the surface for no reason. They're messages from organs that are struggling silently inside. A groundbreaking study published by researchers specializing in digestive health revealed something that surprised even experienced physicians. They discovered that the appearance of your tongue directly reflects the health of your liver and intestines, two systems working together every day. If you want to understand exactly what your body is trying to tell you and how to respond starting today, stay with me until the end. And tell me in the comments where you're watching from. I love knowing that people from so many different places are taking care of their health. Think about the last meal you ate yesterday. Maybe it was something simple. Maybe something you've been eating for years without thinking twice. Your liver had to process every single bite, filtering toxins, breaking down fats, and working quietly without you noticing a single thing. But when your liver gets overloaded, when it starts struggling to keep up with the demands you place on it every single day, it sends signals. Your intestines are like a garden inside your body, and just like a garden, they need the right balance to stay healthy and strong. When harmful bacteria and fungi start taking over that garden, when they crowd out the good organisms that help you absorb nutrients properly, chaos begins. That chaos shows up in places you wouldn't expect, and one of the first places it appears is right there on your tongue every morning. And now pay very close attention, because I'm going to reveal the 8 signs your tongue is showing you right now that demand your immediate attention. These are the exact signals that tell you your liver and intestines are calling out for help, and you need to listen before it's too late. Sign number 1, a thick white coating that returns quickly after cleaning. If you scrape your tongue in the morning, and by lunchtime that white layer is back again, this isn't just a hygiene issue at all. This coating is made up of dead cells, bacteria, and fungi that are multiplying faster than your body can naturally remove them from the surface. Researchers at major digestive health institutes found that this rapid return indicates an imbalance in your gut flora, what doctors call intestinal dysbiosis today. When harmful organisms outnumber the beneficial ones in your intestines, they produce waste products that your body struggles to eliminate properly and efficiently. Your liver, already working overtime to filter toxins from everything you eat and drink, becomes overwhelmed by this additional burden every single day. For people over 55, this becomes even more critical because your liver's natural ability to regenerate slows down significantly with each passing year. The practical solution starts with reducing foods that feed these harmful organisms, especially refined sugars and white flour products you eat daily. At the same time, introduce foods that support healthy bacteria, like plain yogurt with live cultures, sauerkraut, and fiber-rich vegetables every meal. Drinking warm water with lemon first thing in the morning helps stimulate bile production, which is your liver's natural way of flushing out accumulated toxins. Remember, sign number 1 is that persistent white coating, and it's telling you that your internal garden desperately needs attention and care right now. When you address the root cause inside your digestive system, that coating will naturally disappear and stay away without you having to scrape constantly. This is your body's first gentle warning, and listening to it now can prevent much more serious problems from developing down the road ahead. Sign number 2, swelling with visible tooth marks along the sides. When you look at your tongue and see indentations from your teeth pressed into the edges, this is called a scalloped tongue by medical professionals. This swelling happens because your body is retaining excess fluid, and often this fluid retention is linked to a sluggish metabolism and poor circulation overall. A study conducted by gastroenterology specialists found that this type of swelling frequently appears when the liver isn't processing fluids efficiently through the system. Your liver produces bile, which is essential for breaking down fats and helping your body eliminate waste products through proper digestion every single day. When bile production slows down or becomes thick and sluggish, your entire system starts holding on to water and toxins it should be releasing naturally. For people in their 50s and beyond, this becomes particularly noticeable because hormonal changes and reduced physical activity compound the problem significantly over time. The inflammation causing this swelling isn't just local to your tongue. It's a sign of systemic inflammation happening throughout your entire body right now. To address sign number 2, focus on foods that support liver function and reduce inflammation naturally, like leafy greens, beets, and dandelion tea regularly. Reducing your salt intake helps tremendously with fluid retention, especially if you've been eating processed foods that hide excessive amounts of sodium in every serving. Gentle movement throughout the day, even just walking for 15 minutes after meals, helps your lymphatic system drain excess fluids more effectively than sitting still. Sign number 2, those tooth marks on a swollen tongue, is your body asking you to lighten the load on your liver and kidneys immediately. When you respond with the right dietary changes and movement, you'll notice the swelling decrease within just a few weeks of consistent daily effort. Sign number 3, a yellowish tint mixed with the white coating on the surface. When that white layer on your tongue starts taking on a yellow color, especially toward the back, this is a red flag for your liver health. Yellow coating often indicates that bile, which should be flowing smoothly through your digestive system, is backing up or becoming stagnant inside your body. Medical researchers have documented that this yellowish appearance correlates strongly with what they call sluggish liver syndrome, or mild cholestasis in technical terms today. Your liver produces bile constantly, storing it in your gallbladder until you eat a meal, then releasing it to break down fats properly for absorption. When bile becomes thick and moves slowly, it can't do its job effectively, and toxins that should be eliminated start circulating back through your bloodstream. This creates a vicious cycle where your liver has to work even harder to clean blood that keeps getting recontaminated with the same waste products. For people over 55, gallbladder and liver function naturally decline, making this yellow coating a particularly important warning sign to address immediately and seriously. The solution for sign number 3 involves foods that thin bile and promote its flow, such as olive oil, lemon juice, and bitter greens like arugula. Drinking warm liquids, especially herbal teas like peppermint or ginger, helps stimulate bile movement and prevents it from becoming thick and sluggish throughout the day. Avoiding heavy, fatty meals late at night gives your liver time to regenerate during sleep, which is when most of its repair work happens naturally. Sign number 3, that yellowish tint, is your liver literally showing you through your tongue that it needs support, rest, and better nutrition right now. Sign number 4, a burning or tingling sensation on your tongue that comes and goes unpredictably. This uncomfortable feeling, sometimes described as pins and needles or a mild burning, is often dismissed as stress or anxiety by people who experience it. But research from nutritional science departments at major universities has linked this sensation directly to deficiencies in B vitamins, particularly B12 and folate today. When your intestines aren't absorbing nutrients properly due to imbalance in your gut bacteria, these essential vitamins simply pass through without being absorbed into your bloodstream. B vitamins are crucial for nerve health throughout your entire body, and your tongue, being packed with sensitive nerve endings, shows deficiency symptoms first. This malabsorption problem often stems from the same intestinal dysbiosis that causes the white coating, creating multiple symptoms from one underlying root cause. For people over 55, stomach acid production naturally decreases, which makes it even harder to absorb B12 from food sources like meat and dairy. The burning sensation in sign number 4 is your nervous system sending out a distress signal that it's not getting the fuel it needs to function. To address this, focus on easily digestible sources of B vitamins like eggs, nutritional yeast, and fortified cereals that don't require as much stomach acid. Fermented foods like kefir and kimchi help restore the gut bacteria that actually produce some B vitamins naturally inside your intestines every single day. If burning persists despite dietary changes, consider a B-complex supplement after consulting with your healthcare provider about appropriate dosages for your age. Sign number 4, that burning or tingling is your body's way of saying the nutrient pipeline from your gut to your cells has been disrupted. Sign number 5, a geographic tongue with irregular patches of smooth and rough areas that seem to move around over time. This pattern, which doctors call geographic tongue because it looks like a map, appears when patches of your tongue lose their normal texture temporarily. While medical science doesn't fully understand every cause, recent studies have connected this pattern to inflammatory conditions in the digestive tract below. The smooth patches appear where tiny bumps called papillae have flattened or disappeared, and this often happens in response to systemic inflammation throughout your body. When your intestines are inflamed from food sensitivities, bacterial overgrowth, or chronic stress, that inflammation doesn't stay localized, it spreads through your bloodstream everywhere. Your tongue, being one of the most sensitive and fastest healing tissues in your body, shows these inflammatory changes more quickly than other areas. For people over 55, inflammatory conditions become more common as the immune system becomes less precise in distinguishing real threats from harmless substances. Sign number 5 is particularly important because it often appears alongside other autoimmune or inflammatory conditions that need attention from healthcare professionals soon. To support your body with this sign, eliminate common inflammatory triggers from your diet, starting with gluten, dairy, and processed foods for at least 3 weeks. Anti-inflammatory foods like turmeric, ginger, fatty fish, and colorful vegetables help calm the systemic inflammation that's creating these tongue patches over time. Keeping a food diary helps you identify specific triggers, as you might notice the geographic pattern worsens after eating certain foods consistently. Sign number 5, those moving map-like patches, is your immune system's way of showing you that inflammation is active and needs to be addressed. Sign number 6, bad breath that persists even after thorough brushing and using mouthwash multiple times throughout the day. Chronic bad breath, called halitosis by dentists, often originates not from your mouth but from deeper in your digestive system where problems are brewing. When your liver is overwhelmed and struggling to neutralize toxins effectively, some of those toxins get released through your breath as volatile compounds with unpleasant odors. Similarly, when harmful bacteria dominate your intestines, they produce sulfur compounds and other gases that travel up through your digestive tract and exit through your mouth. A comprehensive study on digestive health found that people with persistent bad breath often had significantly higher levels of harmful bacteria in their gut flora. This isn't about poor dental hygiene, it's about internal fermentation and putrefaction happening in your intestines when digestion isn't working properly at all. For people over 55, digestive enzyme production decreases naturally, which means food sits longer in your intestines, giving bacteria more time to produce foul-smelling gases. Sign number 6 is your digestive system literally broadcasting its distress through your breath, and no amount of mints will fix the underlying problem permanently. The solution starts with improving digestion by eating smaller meals more frequently, which prevents food from sitting too long in your system fermenting. Digestive enzymes taken with meals can help break down food more completely, leaving less material for harmful bacteria to feast on and produce gases. Probiotic foods and supplements help rebalance your gut flora, reducing the population of odor-producing bacteria while strengthening beneficial strains that aid proper digestion. Sign number 6, that persistent bad breath, is a clear message that your internal environment needs cleaning and rebalancing from the inside out immediately. Sign number 7, a dry, cracked tongue despite drinking what you think is enough water throughout your day. When your tongue feels constantly dry and develops cracks or fissures, this goes beyond simple dehydration. It indicates a deeper metabolic issue. Your liver requires adequate hydration to produce bile and process toxins, and when it's not functioning optimally, it can affect your body's entire fluid balance. Research from internal medicine departments has shown that liver dysfunction can disrupt the hormones that regulate how your body retains and distributes water throughout all tissues. Additionally, certain medications commonly prescribed to people over 55, like blood pressure pills and diuretics, can contribute significantly to chronic dryness everywhere. A dry tongue can also indicate that your body is in a state of chronic low-level inflammation, which increases your fluid requirements beyond normal levels. When your intestines are inflamed, they don't absorb water as efficiently, meaning you could drink plenty but still feel dry because absorption is impaired significantly. Sign number 7 is your body telling you that the water you're drinking isn't being properly utilized, or that you need more than you're currently consuming. To address this, increase your water intake gradually, aiming for at least 8 glasses daily, and add a pinch of natural sea salt to help with absorption. Eat water-rich foods like cucumbers, watermelon, and celery, which provide hydration along with minerals that help your body retain that water more effectively. Avoid excessive caffeine and alcohol, both of which act as diuretics and can worsen the dryness problem significantly, especially in older adults with slower metabolism. Sign number 7, that persistent dryness and cracking, is asking you to reassess both your water intake and how well your body is actually using that water. Sign number 8, a coated tongue that's accompanied by digestive symptoms like bloating, gas, or irregular bowel movements throughout the week. When your tongue issues appear alongside these digestive complaints, you're seeing the full picture of intestinal dysbiosis and liver overload working together negatively. This combination tells you that the problem isn't isolated to one area. It's a system-wide imbalance affecting your entire digestive tract from top to bottom. Major gastroenterology studies have confirmed that patients with visible tongue coating almost always have measurable imbalances in their gut bacteria composition when tested properly. The bloating happens because harmful bacteria produce excessive gas as they ferment undigested food particles that should have been broken down much earlier. Irregular bowel movements occur because your liver isn't producing enough bile to stimulate proper intestinal contractions, leading to either constipation or loose stools unpredictably. For people over 55, these digestive issues can significantly impact quality of life, causing discomfort, embarrassment, and reluctance to eat socially with family. Sign number 8 is the most comprehensive warning, showing you that your entire digestive system, from tongue to intestines, needs immediate supportive intervention now. The solution requires a holistic approach, combining dietary changes, probiotic support, liver-supportive foods, and stress reduction all working together as one strategy. Start by eliminating foods that feed harmful bacteria, particularly refined sugars, white bread, and processed snacks that create the perfect environment for dysbiosis. Add fermented vegetables, bone broth, and plenty of fiber from whole foods to feed beneficial bacteria and support regular, comfortable bowel movements naturally. Sign number 8, that coated tongue with digestive symptoms, is your body's final call for you to take comprehensive action before things progress further. But before you start making all these changes, there's one critical mistake that almost everyone makes, and it can completely undo your progress. Many people, when they learn about gut health and liver support, immediately rush to buy expensive probiotic supplements from the pharmacy without changing anything else. Here's what researchers discovered that shocked even experienced nutritionists. Taking probiotics while continuing to eat sugar and processed foods is like planting flowers in toxic soil. The beneficial bacteria from supplements simply cannot survive or establish themselves in an environment that's still feeding the harmful organisms you're trying to eliminate. You must first clean up your diet, removing the foods that feed bad bacteria, and only then will probiotics have any real chance of colonizing successfully. Additionally, many people scrape their tongue aggressively multiple times per day, thinking more is better. But this can actually damage the delicate tissue unnecessarily. The tongue needs gentle care, not aggressive scraping, and the real healing happens from the inside out through diet and liver support, not from outside. This mistake of focusing on surface solutions while ignoring the root cause is why so many people see their symptoms return again and again. Now let me give you a simple plan you can start using today to support your liver and restore balance to your intestines naturally and safely. Begin each morning by gently scraping your tongue once with a tongue scraper or the edge of a spoon, removing the overnight buildup calmly. Follow this immediately with a glass of warm water with the juice of half a lemon, which stimulates bile production and helps your liver wake up. For your meals, focus on adding bitter greens like arugula and dandelion, which naturally support liver function, and fermented foods like sauerkraut for gut health. Reduce your intake of refined sugars and white flour products gradually over 2 weeks, replacing them with whole grains, vegetables, and lean proteins instead. Drink at least 8 glasses of water throughout the day, spacing them evenly, and consider adding herbal teas like peppermint or ginger between meals. Take a 15-minute walk after your largest meal to support digestion and help your lymphatic system move fluids more efficiently throughout your body. Now here's something very important. If you're taking medications for blood pressure, diabetes, or blood thinning, please talk with your healthcare provider before making significant changes. Some foods that support liver health, like grapefruit and certain herbs, can interact with common medications prescribed to people over 55 years old. Also, if you have existing liver disease, gallstones, or any diagnosed digestive condition, professional guidance is essential before starting any new dietary approach. These suggestions are meant to support your overall health, but they work best when integrated thoughtfully with any medical care you're already receiving regularly. Your doctor knows your complete health picture and can help you implement these changes safely, adjusting as needed based on your specific situation and needs. Remember that person who looked in the mirror this morning and saw something strange but didn't understand what their body was trying to say clearly? Now you know exactly what those signs mean, and knowing is always the first and most powerful step toward making real change in your health. If this video brought you new understanding, leave your like and share it with someone you care about who might be seeing these same signs. You'll notice we have 2 videos on the screen now, and I'm sure you'll want to continue taking care of your health with us today. Take good care of yourself, listen to what your body tells you, and remember that small changes today create big results tomorrow and beyond.